Anesthesiologists administer pain medication to patients, usually for surgery. They're the pain managers of the operating room. I was initially drawn to this career after seeing the average salary for an anesthesiologist. They make a lot of money. The path of education for an anesthesiologist is long and can be difficult. It demands perseverance and determination and dedication. It first starts with 4 years at your standard university, then another 4 years of medical school. Lastly, a residency of 3 years minimum is needed for the doctor to gain enough experience in the workplace. Anesthesiologists, like all doctors, need to be knowledgeable in biology. They could also learn how to operate special machinery, which makes them more desirable and valuable because now they're specialized and can do things other doctors can't. Anesthesiologists have to know about chemistry and math because they use formulas to calculate the amounts of anesthesia needed for a patient. That's something they can't mess up on. They may major in other things, though. The anesthesiologist I interviewed got his degree in genetics. An anesthesiologist needs to be logical and cool under pressure and know what to do at all times. They consider themselves the brains of the operating room. The surgeons, then, are the blood. The divide of personalities in the operating room is then called the blood-brain barrier. When an anesthesiologist puts their patient to sleep, they do so using formulas using height and weight of the patient to see how much anesthesia will be necessary. They also take into account how the internal organs of that patient could react to the drug. During the whole procedure, the anesthesiologist monitors the patient's vital signs. The hard part about being an anesthesiologist is the odd hours that take you away from friends and family. Someone with this job may end up missing important birthday parties or other family gatherings. They just miss out on family time. The best part is helping people, though, like it is for all doctors. The large paycheck doesn't hurt that either. A huge part of anesthesiology is just knowing how to do your job and being prepared to react in stressful situations. I still may be an anesthesiologist, but I am also thinking of being a nurse. I haven't ruled that out. At this point, I don't really know what I'll do for sure. I'm still making up my mind.